When you're taking a history from a patient with a meniscal tear, one should always consider the age of that patient. In a young patient, the meniscal tear is more likely to be acute, and it's generally happened from a small twisting injury to their knee while playing sport or while exercising. This is generally, when you talk to that patient, the patient could play on the match and finishes off the match and gets the swelling and the pain the next day. Whereas the more severe ligamentous injuries, such as the ACL, they tend to fall to the ground, they couldn't play on, and they have an acute large hemarthrosis. When you talk to the patient with a meniscal tear, they feel something tearing in their knee at the time of their small injury. With rest, those symptoms, pain, stiffness, and swelling, they tend to settle. Every time they go back exercising, those symptoms come back. That is because the meniscal tear keeps irritating the knee. When you look at the middle age, keeping in mind that the meniscal tissue degenerates with time and becomes a bit more brittle, tends to tear easier. And therefore, the injury sometimes may not be remembered by the patient, but is generally a small innocuous injury, twisting injury to the knee while doing work around the house, while painting the skirting board, while being in a flex position of the knee with a small twisting injury. Again, the symptoms are similar to the young one, and such as the pain localized to the compartment of the knee, stiffness caused by the small amount of swelling. When those patients rest, those symptoms tend to settle. Whereas when they go back to trying to exercise, they get back the symptoms and it becomes quite frustrating for them. When dealing with the older population, over the 65, 70, one has to bear in mind that if we MRI these patients, a large majority will have a degenerative meniscal tear as much as they would have arthritis in their knee. In that patient's population, treating that surgically may not necessarily help them.